If your teenage child has been diagnosed with chronic pain or functional neurological disorder, short for FND, and you as a parent, I can only imagine the frustration and confusion and quite honestly, some type of helplessness because you might be struggling to find the answer and solution to fix your child's problem. If that's the case, hold that thought because you are the biggest solution for your child's recovery from these persistent physical symptoms such as chronic pain and FND. As a pediatric psychologist and chronic pain survivor myself, my mission is to eliminate teen chronic pain and FND by helping teens and parents like you to feel empowered to find the solutions to recover from these symptoms. If you're new to this channel, please make sure to click the link below because I do have a free PDF parenting guide for teens at home, and it's completely free and it's available right now. So in today's video, I want to talk about the second study to basically demonstrate why I keep saying parents are the biggest solution for their child's recovery from chronic pain and FND. So I'm going to prove to you by sharing this scientific study to basically say what I'm saying is legit, okay? All right, so let's get started. And this is a study by Wiggins and colleagues from Australia that was published in 2021, so fairly recently. So what they did was they focused on database for children, a little over 100 people, who came to the hospital in Australia for some somatic symptoms and those kids who got diagnosis of somatic symptom and related disorders. That includes chronic pain and FND. Okay. And then these same kids and family were also followed up 12 months after initial visit to this hospital. Okay. All right. And what they actually looked at was that they literally looked at whether the parents of these kids who got diagnosed with this disorder, such as chronic pain and FND, whether these parents fully, partially, or not accepted the diagnosis of their children. Okay. And what they found was pretty fascinating, but to me that makes sense, but this is really helping me to say what I'm saying is legit. Okay. So about 1/3 of the people who came to the follow-up, which was, I would say, about 30, 40 families, and these kids had a full recovery from these somatic symptom and related disorders at that follow-up, okay? And then more people had a partial recovery, so a little bit over 40% of the people. So about out of the 100 people who came to the 12-month follow-up, about 80 people, 80 kids were either fully or partially recovered at 12-month follow-up. They tried to figure out what was the difference between these kids who recovered versus who didn't, all right? And then here's a kicker. The parents of these patients who had a full acceptance of their child's diagnosis were significantly more likely to recover from this diagnosis completely, regardless of the patient's, the kids themselves' acceptance level, gender, symptom complexity, medical history, or mental health history. By how much? The odd ratio was 8. So what that means is the odds of these kids having full recovery from somatic symptom and related disorders were 8 times more likely to be linked to the parents' acceptance of the diagnosis. So really, this was fascinating because if the parents accept the diagnosis, and what that means is they're more likely to get the treatment or the help that they need for their kids to recover from this diagnosis rather sooner than later, right? I have seen some parents actually refusing the diagnosis of either chronic pain or FND as what it is, and then they keep going into this rabbit hole of there's gotta be this hidden diagnosis, there's gotta be something else, there's gotta be something that these doctors are missing. And so they just keep going to this endless cycle of testing, doctor's visits, endless treatment and procedures and things like that, while they are completely refusing or ignoring the fact that these kids might be having FND or chronic pain or other somatic related disorders. So in a way, these families are sort of missing the boat and they're missing the chance of getting the early treatment, right? And then that's exactly what happened. And that is part of the reasons why I always emphasize whenever I work with teens, parents' involvement is absolutely critical and necessary. And that being said, I also emphasize parents promoting the independence of teens is just as equally important as parents being involved. So when I say parents' involvement, it doesn't necessarily mean the parents need to be micromanaging and then hovering like a helicopter. In fact, quite the opposite. There are many things that parents can continue to do that helps towards a recovery, or tweaking things or not doing things to actually help towards a recovery of their child's chronic pain and FND conditions. Well, thank you so much for watching this video, and I will see you in the next video.